9:45. Let's go into the KUAM News Zoom room. We're standing by. We have from the Physicians Advisory Group, Dr. Michael. Good morning, Doc.
Hey, good morning, guys. Thanks for having me on again.
Always a pleasure. Just to clarify, you're the Education Committee Chair with the PAG?
Um, yeah, I'm on the on the education subcommittee. I
Okay.
guess the chairman person title is yeah more than
You
anything.
didn't know you're the chair. Well, you are now, right? uh,
Sure, why not?
Congratulations.
Right. And I mean, we've had you on and we've talked about schools and, the conversation and what we've said has actually changed as this pandemic has gotten worse.
Yeah,
I remember early on, you were saying that, yeah, it was totally possible. There was a study that was, you guys did with the Japanese school of Guam. But we kind of wanted to start with just your reaction. I know you weren't involved in the decision in any way because Dodea kind of operates within their own bubble. But just as a doctor sitting on a committee that will look at the return of face-to-face learning for everyone outside the fence line, what are your thoughts on Dodea schools reopening next week?
I'm cautiously optimistic that it's going to go really well. I really hope it does, of course. When the concern is when the cases get really high in the community, it's not so much that the kids will necessarily catch it in school and pass it along, but rather that the adults in the community will catch it, and then that includes staff, and then that'll come down to the kids. And then, of course, the other thing that we're seeing with such high cases now is just more and more kids are getting it because the parents are getting it, right? So I haven't seen Dodea's, the plans or the measures they put in place, but I assume that it's, all up to, CDC guidelines and, maybe even stricter. So we'll see what happens. We'll be watching this really carefully, and hopefully it goes really well. And I know a lot of parents out there, right? I think there was a couple surveys done, one by DOE, one by some of the private schools, and they were pretty consistent that about 2/3 of parents out there, you guys are not alone in thinking that you guys are a little unsure about sending your kids back. And then about a third of the parents out there are ready to send their kids back, and they are pretty
Those are the
confident
ones, the
in
naughty
measures that
kids.
are be taking place. Yeah, so I think it can go well, and there's very likely. I just want to tell all the parents out there, once schools open up, whether it's really soon or next semester or next year, it's a very high chance that at some point there's going to be a child that is positive that we find in school, but really the measure of success is going to be, well, do we have to close down the entire school, or were we able to kind of target and isolate who was affected? Maybe keep that cohort out, and then let the rest of the school go on.
Right, yeah.
So that'll be the challenge.
Interesting points because you do hear a lot of proponents for the return of face-to-face learning say things like, "Oh, the kids they don't really get it," or "Oh, they do fine." But I mean, who the hell you think's teaching the kids? The grown-ups. You know what I mean? And we've seen the virus
Yeah,
spread with adults, obviously.
yeah. And
Uh,
then the other thing that we talk about the socialization and the learning, but I was reading an article about Bethany Taylor with Harvest House and how the reports of child abuse is way down, which is a really chilling fact to hear about. And besides that, we have we're reading about mental health and suicides were going up. So it's really just there's so much that now I think a lot of the adults are understanding, like school, it's not just to go there to learn to read and
right,
learn your math, but it's really a crucial part of a childhood, really.
right. Doc, maybe you could put on your pediatrician hat now and let's talk a little bit about Halloween.
Yeah, I haven't really heard too much yet. And usually around this time we start getting a patient coming in with really cute costumes. I mean, with trick or treating, definitely there's ways you can do it safely, right? You can socially distance and build face masks into the costumes. I think I saw some pretty inventive ones online already. Um, but yeah, I think it's possible to for kids to have a good Halloween still. I mean, we really just need to avoid like the big parties, right? I mean, it just pretty obvious at this
So are you
point.
suggesting that as long as we wear masks and practice the 3 Ws, it's okay to go trick-or-treating?
Um, with the caveat, yeah, I mean, it's kind of the same thing anywhere, right? We want to avoid large gatherings. The tricky part is, um, it's once we get out and it's kind of natural, you just kind of want to congregate if you see other people,
Right.
especially since we're all kind of like socially starved now. But yeah, I mean, I think if parents are very mindful, and kids are definitely going to be excited and they're going to want to go out and have a good time. But if we're all really mindful and very careful, it's possible. But honestly, I'd be more I'm more concerned about the adults, and if we see another uptick in cases afterwards, then yeah, I'm going to be eating my words and saying no, we definitely should not have been doing that.
Yeah.
So
Well, I mean,
yeah,
you want to eat them now or you want to eat
it's
them
on
later? It's up to you.
us. Please, everybody, be careful.
Yeah.
Don't make me eat my words.
Right.
We do see, though, the increase in the numbers with the 0 to 9-year-olds, like, for example, 16 new cases in the past several days, 10 to 19, 15 new cases in the past several days. Is that cause for concern, or this is kind of like what we should expect?
It is a cause of concern. I'm not on service at the hospital right now, but I do get the kind of daily updates on what the census is looking like. And I was actually shocked. I saw that there were some COVID cases that were ICU level for kids. I don't know the details of those cases, but I think those were probably the first couple true ICU cases due to COVID. And so when the kids are getting it, it's really a reflection on how widespread it is in the community. I think I saw a chart recently, listed the 50 states and territories, and Guam was in a dark red portion. And if you look on the little legend, what it says, dark red was unchecked communities, widespread. And, that's really what we have right now.
Send me that.
Yeah, I will.
Yeah, thanks, Doc. I guess just again on Halloween, what about this idea that what we're starting to see, Doc, is kind of like drive-through Halloween? Do you think that kids still have a good time doing that?
Oh,
Is that
drive-
kind of a safe way? I know there's a couple of mayor's offices who are kind of doing like drive-through,
And the guard.
get the candy. The guard is also doing a drive-through. So I've seen this migration of
Oh,
people
yeah.
trying to like COVIDify Halloween, if you will, with different protocols.
Oh, I hadn't heard about that, but that's very creative, and there's a way to. I'm sure they can make that really fun for the kids. It kind of reminds me of the drive-through graduations that they had,
Right.
early in the year. And actually, like looking at some of those photos, like it actually looks really fun.
Yeah.
And,
Well, they made the
all get
most
to
of
have
it
their
for
own
sure.
Moment to shine.
Yeah. Doug, just
Oh, sorry.
they made the most of it with the drive-through grads.
Oh, yeah, yeah. Oh,
definitely.
yeah.
Yeah. Just what are you making of these numbers though, and the hospitalizations and the deaths that keep coming, Doc? Is it
Yeah.
overwhelming?
It is. They're really sobering. What it is, well, I mean, I don't know exactly what it is, but it's all over our community. I recently tested, had a patient, or well, not a patient, a person that came to my clinic to get tested, no symptoms, could not pinpoint a contact, and was just going to work, and the company just wanted everybody to get tested because they found another case. And I was super shocked, he was super shocked, and we sat down and really talked about like what it means to like self-isolate. Thankfully for him, it was pretty easy to live alone, but multiply that by however many times in a community, and people who are pretty well appearing, asymptomatic, might not even think they're at risk because they can't recognize the contact. They're around in the community. So I don't know how the COVID alert app, what the download status of that is so far, but yeah, every patient that comes in to get tested, I highly recommend that they download it just to give some sort of advantage to them. So if they get alert and then later they feel like a little tickle in their throat, maybe just get checked.
Wow. Pretty good.
Yes.
Yeah, I think she's texting the court. Maybe. But Doc, anything in closing? Because you seem a little more reserved than, I mean, usually bubbly and upbeat, and I just want to make sure these numbers aren't,
Yeah,
I mean, it's
it's
getting to all of
been
us.
yeah, it's been a long 8 months, right?
Yeah, yeah.
It's catching up. I think it's time for. I think I need a break too. That or at least a haircut. Oh man. But yeah.
I didn't want to say anything, but I mean, is there a shortage of hair product out here? Because usually you're done up pretty good.
No, the problem is my hair is getting too heavy. There's not enough hair product to keep it up anymore. I just did a haircut.
All right, Doc. Anything in closing you want to add before we let you go?
Please, we all know what we have to do, and actually, you know what? The face mask, I really like that Guam is really good about wearing them. And I do tell the story about how, when I had COVID, my wife, she was terrified that she was going to get it and pass on to her patients. So we isolated at home, but all we did was wear a face mask at home. And she, tested negative 4 times over a period of 8 days. And so I just really want to tell everybody, like, if you think you're sick at home and you're not sure, just wear a face mask at home. It'll do a lot of good.
Thank you, Doc.
Thanks, Doc.
All right. Thanks, guys.
See you. Enjoy your coffee. Yeah. And send me that chart. I'd like to see that.
Oh, yeah, we'll do.
Okay, Doc.
Thanks.
Appreciate it. Dr. Michael Lum, the Physicians Advisory Group. He's on the Education Committee. Cautiously optimistic about Dodea School's reopening. So
They
there
actually
you go.
discussed this issue during one of the hearings late yesterday.
What was the tone of the discussion, Bree?
Well, the parts that I listened to, I know Senator Therese Jalai had raised the issue, just wanting feedback from Congressman Mike St. Nicholas, and Artson Augustine spoke. Former Congressman Robert Underwood spoke about it, because